Hello friends, welcome to another clinical short video that is on acute epiglottitis. Also known as supraglottitis, it is a rapidly progressive life-threatening emergency most commonly seen in age group of 2 to 6 years. What are the important organisms causing this disease? Most common is Haemophilus influenzae type B. It is very important because it is mainly seen in unvaccinated child who are under the age of 4 years. What are the other organisms such as group A beta hemolytic streptococci and Streptococcus pneumoniae? What are the symptoms of this disease? Patient will run with high grade of fever. There will be respiratory difficulty, dysphagia and rhinophagia will be seen. Patient will have a muffled voice. In this disease, it is also seen that child deteriorates within a very short span of time. Child was doing well and good just half an hour before. Meanwhile, after half an hour to 1 hour, patient will be very critical. That needs hospitalization. What are the important signs? Tachycardia will be present. Fever will be out of proportion. There will be a tripod sign. What is tripod sign? Patient will be sitting and leaning forward with his neck and chin extending anteriorly. Okay, so this is the characteristic tripod sign. I will show you in the images further. There will be drooling, inspiratory stridor will be present, and patient will have a characteristic toxic look. Now coming to examination. Examine the larynx and oral cavity without much intervention. Do not distress the child, as irritation may lead to laryngospasm and that may lead to fatal complications. On examination, pharynx will be seen congested with pooling of saliva. There will be extension of neck and chin. Like I previously told, patient will be sitting in a tripod position, that is also known as tripod sign. Also, there will be respiratory obstruction because of the red and severely swollen epiglottis, that is characteristically known as sunrise sign. Okay, so we have to avoid intubation also. Basically, we have to secure the airway, but avoid early intubation. Prefer tracheostomy whenever possible. Here we can see in this image, in the X-ray neck lateral view, there is a structure that is marked by white arrow, that is swollen epiglottis. It is giving characteristic appearance of raised thumb. So that is known as thumb sign. In the second image, we can see tripod position in which patient is sitting and leaning forward with his neck and chin extended. Okay, so that is characteristic tripod position. Patient usually sits only in this position in case of acute epiglottitis. How we will manage this case? There are certain set of investigations that we can perform. We can do flexible fiber optic laryngoscopy on the patient. We can order X-ray neck lateral view that will show us thumb sign. That will be swollen and elevated epiglottis that will give us characteristic raised thumb appearance in the X-ray. Also, we can order CBC, blood culture and throat swab. Now coming to the treatment part. Do not irritate the child. That is the most important thing. First of all, secure the airway. Do tracheostomy over intubation as it is preferred, because it causes much less irritation of the larynx and pharynx. We can give oxygen inhalation. We can do nebulization of the patient with epinephrine. Also, we can give IV antibiotics. The drug of choice is ceftriaxone. We can give steroids also and shift the patient to the ICU care settings. That was all about acute epiglottitis in short. Follow this channel for more such contents. Thank you.